delighted to introduce Dawn Lund, our speaker today. Dawn is Director of Medicare Programs at Senior Community Services, and in that role, she draws on over 30 years of experience working with seniors and their family members and caregivers, offering support, advocacy, assistance, information, and referrals. Dawn holds a bachelor's degree in family social science from the University of Minnesota and a master's degree in gerontology from Bethel University, and she's going to talk with us about the Gray Tsunami. So please join me in welcoming Dawn Lund.
Before I start, I'm just very curious what the requirements are to be a member. You guys are really fun. But seriously, thanks for everything that you do. I'm impressed. Think of a beloved elder adult in your life. Most likely it's a parent, grandparents, aunt or uncle, or maybe a longtime neighbor or friend. We are the product of the older adults in our lives. We stand on their shoulders, in fact. When we were small, they sacrificed and served as examples for us. They offered a listening ear, loving guidance, and a hug when we needed one. In time, the roles evolve, and at some point, they become more vulnerable and depend on us to be there for them as they were for us. At Senior Community Services, our vision is to mobilize the community to reimagine aging. And we share our exciting work with communities through the Reimagine Aging Institute. Our nonprofit organization is to help seniors maintain their independence and to give a helping hand to their caregivers who are often overwhelmed and exhausted from providing care for their loved one. I'd like to see a show of hands. How many of you are providing some type of caregiving to a friend or a loved one? That is it's an incredibly relevant issue for everyone. You may not realize that it is affecting you. If you're not a caregiver for an older adult today, you will be most likely in the future. We like to say there are 4 kinds of people in Minnesota. Those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. Caregiving is really hard, emotionally challenging work. A labor of love, certainly, and sometimes love is not enough to get you through. Let's do a little time traveling. Family caregiving has taken a quantum leap in the past 160 years. When Minnesota became a state in 1858, 70% of elderly adults lived with their children. When a parent or grandparent needed help, the support was all under the same roof of their pioneer cabin. And the younger generations in the household had a good understanding about what it was like to grow old because they saw it up close and personal. By 1950, 21% of the overall population were living in multi-generational homes. Today, it's only 16% of seniors living with their families. We see many older adults living independently in their own home well into their 80s and 90s. They still need support from their loving caregivers who may live with them, or the caregiver may be stopping by frequently to help with different things like cooking, shopping, household chores, and healthcare needs. Many families are more dispersed, with their children and other relatives scattered across the country. This obviously makes caregiving very challenging. Today, in about 9 out of 10 cases, senior care is provided by family and friends. Although the needs are growing, many of us members of the 78 million strong baby boomer generation. This is the largest generation in all of human history. All of these boomers are retiring at a rate of 10,000 a day nationally. That's a lot of boomers. In our nation, which values youth, there will soon be more seniors than school-age children, right here in Minnesota. That's the forecast for 2020. By the year 2030, a quarter of Minnesotans will be 65 or older. The number of people aged 85 and up will actually triple. If you think about that, it's almost shocking. Oftentimes, we don't even talk about aging, so I think it's important to realize that pretty soon it'll be our largest piece of the population. Significant implications for all of us, for our state and local communities like yours here in Bloomington, and for our local nonprofit organization like ours at Senior Community Services. We partner with 300 other nonprofits to bring services to seniors and their families. One of our very popular programs is called the HOME program. HOME stands for household and outside maintenance for the elderly. This program helps people stay living independently in their home by providing different services like homemaking, handyman work, outside and indoor chores, and yard work, interior, exterior painting, just about anything you can think of, the HOME program will provide for you. We use volunteers and low-cost handymen and women who are checked out quite thoroughly. They have a background check and references that are checked, that go out and provide the service for our seniors on an ongoing basis. It might be once a week, it might be every other week. And oftentimes we hear from our senior clients that they really get excited for that visit. Our program helps seniors to stay living independently in their own home. And most of us want to stay in our own home. So if you think about that, it might just be one or two services that you could receive assistance with that would enable you to stay in your own home and not like move to assisted living, for example. I want to just tell you quickly about a woman named Della. She's a wonderful 85-year-old who lives in the West Metro area with her husband in their longtime home. Neither of them can climb a ladder anymore, so simple tasks like changing a light bulb or washing the windows has become impossible. A few years ago, Della and her husband were debating about whether or not it was time to give up their home. They really dreaded the thought of leaving. Thankfully, Della discovered Senior Community Services, and we're now helping them on a regular basis, and they're still living in their own home. You can actually go online to seniorcommunity.org and order home chore program services for a loved one or for yourself, so it's really easy. This has become a really popular service because I think people are starting to understand the needs and that they're rising and that this is something simple that can help someone stay in their own home. Some families really struggle providing complex care for an older adult, usually a parent or a grandparent. Typically, the older adult is facing serious health issues and loved ones need some guidance as well as practical help. Our senior outreach and caregiver services social workers work directly with the families, seniors, and caregivers. They identify the best combination of affordable community services to help the older adult age in a healthy, safe, and dignified way. My friend and coworker, Christy Roy Reed, who came as my guest today, I was teasing her, telling her she was the one that was going to be up here talking. She's like, you were just bringing me to be your guest, Dawn. But Christy's one of our social workers, and she's out there doing outreach and helping caregivers. She's actually officed at the Creekside Community Center in Bloomington. I get to see her once in a while because my office is in Minnesotan. There are actually thousands and thousands of isolated seniors in the Twin Cities. Many older adults find themselves in a life shock after losing a spouse, and their home may soon feel like a prison, keeping them inside and isolated from others. That's why we operate 7 different senior centers in the metro area. Senior centers offer a diverse, fun, and meaningful place to have activities, and this can prevent loneliness, isolation, and depression. Many of our volunteers, who now themselves are retired, help staff these senior centers, offer welcoming smiles to the older adults who need the friendship and socialization as well as fellowship. These activities give a person purpose, which is very important as we age. We're grateful for the community support that enables these centers to stay open and functioning. As our senior population continues to grow, so does the need for places like senior centers. There are more than 700,000 seniors in Minnesota, and 1 in 5 live either in or near poverty. Many of them have medical debt that has accumulated from the level of that's very overwhelming and unusually impossible to pay off. We have a program called Senior Partners Care that I always say is one of the best kept secrets in Minnesota. It enables qualifying Minnesotans, seniors, to receive help bridging the gap between what Medicare covers and what they don't cover. So any of you that maybe are on Medicare may understand what I'm talking about. But for example, if you're going to the doctor, Medicare covers 80%. If a person doesn't have another plan in place to accompany your Medicare, that person's responsible for 20%. So usually what happens if a person is on a fixed income, not able to afford a secondary plan, most likely they're not going to go to the doctor. And you know what happens after that. If things just get worse and they end up going to the emergency room. And so Senior Partners Care actually is a huge network of clinics and hospitals that have agreed to take Medicare as full payment. So when our members become a part of Senior Partners Care, then they have a network where they can receive their health care and they should never see a bill. There are some things that Medicare doesn't cover, so then that would be another situation. But Senior Partners Care helps so many people, and the guidelines are quite high. You have to be above medical assistance guidelines, and it is a statewide program. And if you think about it, this is just a huge relief when people find out about our program and become members, and maybe they've been needing to go to the doctor for quite a long time, and now they aren't so stressed out and they can go to the doctor and know they're not going to receive a bill. For the newly retired, we offer much relief in the form of Medicare health insurance counseling. Here's a warning, and some of you may know this. When you're about to turn 65, the phone starts ringing, the health insurance pitches don't end, and there's a lot of them. The Daily Mail just floods you with information. I think it's not only confusing, but it's really overwhelming, and people often don't know what to do and which direction they should go into to even try to narrow it down. So we have trained Medicare counselors that are there to assist people with unbiased guidance. So we're able to help them narrow it down and figure out what is the best fit for them. Sometimes we're able to help people save thousands and thousands of dollars, which is huge. I think that's one reason why it's really rewarding for me to help people with their Medicare. Not only does it de-stress the situation, but we usually can help people save money. We actually rely on our volunteers at Senior Community Services to do much of the support and outreach to seniors. More than 4,000 volunteers help us serve 25,000 seniors in a year. I think nowadays it's really common to hear about volunteers kind of making a program be sustainable. Oftentimes it wouldn't happen without volunteers. and you all in this room know that. As boomers age, we see the needs continuing to grow. And as a nonprofit dependent on charitable support, we work hard to raise awareness so we're able to respond to the needs of seniors. So it's important that we all work together to reimagine aging and to make these later years a satisfying time that's more secure, safe, and enjoyable for all generations. That means making our communities as senior-friendly as possible. So it's as welcoming to walkers and wheelchairs as they are to strollers, bicycles, skateboards, and rollerblades. Thank you. If you have any questions, I'd be happy to answer.
About the financial impact on the state and the country going forward in the next 5 years, what kind of projections you have?
I feel kind of scared myself personally. Over the weekend I was in Wisconsin visiting my parents, and my dad is 80, my mom is 76. And we were talking about things, and my dad just kind of looked at me and said, I'm scared for you and your children. I mean, the future, we no longer have pensions, who knows what's going to happen to our IRAs. That piece of it's really scary. I guess I feel like programs like ours at Senior Community Services, I think the phone is going to be ringing a lot more. The more people learn about us, I think more and more seniors are going to be needing help. And we already have a huge part of our population where people are needing help now. They're living below the federal poverty guidelines. It's really sad and it's really scary. I guess my advice to you would be know that there's probably something out there that can help somebody. If you have someone in your life that's having a rough time, I think those situations, unfortunately, will be increasing. So again, I think programs like ours are really, really important. They can change people's lives. It's a hard question to answer. Yes?
I'm on the fall aging committee, as I'm with Martin Luther campus, and actually, as far as the numbers aspect, it's very, very concerning. We have an expert, a state demographer. She works with the state demography office, Andy Egbert, coming to speak at, talking about the number of individuals, baby boomers, that will be older adults, and there's literally not enough people to care for older adults in the next coming generation. It's going to be very, it's kind of a doom and gloom. It's like, what do? There's not really how you get young people to be interested in health care and senior care and to provide services for older adults. Not really.
Yeah, it is a doom and gloom situation, but I guess by all of you in this room, if we can try to educate and really get people to start thinking about this, it's almost like we're ignoring the fact that, in 10 more years, we're going to have mostly seniors in our population. There's not enough housing now for seniors that need subsidized housing. I have ideas. I don't know what the answer is, but if we can do things to help people stay living in their homes, I know that's would be huge.
Do you ever talk about the significance of adult day programs to help seniors, older adults living in their home on earth, to keep them stimulated and active and get all the benefits of assisted living, but to stay in their homes?
I do, and I think it's because I worked in adult day for 7 years, so I know how important it is. That's another thing that I used to say was one of the best kept secrets in Minnesota, adult day. Most people didn't know what it was. It's a relief for caregivers, respite. It keeps our loved ones, they have a reason to get up in the morning. They get to go and have fun like you guys. And when I worked in adult day, this was maybe 10 years ago, we all should have had waiting lists, and that wasn't the case. So what do you think? Do you feel like,
We have adult day programs at Martin Luther campus, and it's just far too underutilized.
Yep. I think a lot of it's education and if, making sure people know what's out there and the needs that people have and the things that we need to start thinking about. Yes.
Dawn, is there any group that's kind of in the mental health arena? There's some conveners in different parts of the community that are not just looking at healthcare systems, but looking at community-based programs and state government and local governments and trying to get their arms around how are we going to, help this population with mental health. My question is, how and is there someone convening this kind of conversation around elder care, elder health issues? It's very expensive health care.
Yep.
And how are we as a community convening either late or ahead of the bigger tsunami? Are you seeing any convening going on across different sectors of the elder care spectrum, or is it pretty narrow at this juncture?
I feel like it's fairly narrow. What I see is folks that are in the profession of working with aging, kind of on special networks, groups where they meet on a regular basis and get together and try to problem solve and figure out what might be a really great thing to work on or introduce to a community. What I've seen, just for folks like all of us in this room, to be quite honest, some cities get it and it's on their agenda and they put a portion of their funding towards home and community-based services, and then you guys are this city's one of the really outstanding ones, actually, honestly. There's some other cities I'm working with people on, and it's not even on their agenda at all, and my friends that are in the field are they're kind of lost, and they don't feel like they have a lot of support. So if we can somehow, those people that are making decisions and have some power to make change, I think, if you're one that understands the aging field and how important it is that we start making some changes, maybe you can talk them into it.
So Dawn, thank you so much.
you.
And are you willing to stay around for questions?
Okay, thank you.
So Dawn, stay here. So in appreciation for your speaking presentation today, a donation to End Polio will be made in your name to End Polio Now, which is the signature project of Rotary International. In the early 1980s, there were 400,000 cases of polio a year in the world, and that's when Rotary decided to join with other organizations to lead the eradication of polio. We are so close to eradicating this devastating disease. We have had 12 cases in 2016, and it's been limited to Pakistan and Afghanistan. And at this time last year, we had 23 cases. So we're about half of where we were a year ago. So success over polio will help fuel the energy of what people of the world can do when we work together. And so I would like to give you, here is a certificate.
Thank you.
And here is a Rotary pin of End Polio Now.
Thank you very much.
Thank you so much.